we heard throughout the different very interesting interventions a lot of the challenges that are also faced in trying to deploy investments and achieving the maximum impact when having this gender-focused investment around the world, and particularly in low and middle income countries. And they are governmental related, bureaucracy, political will, as you mentioned, Joanne, um, but also other challenges like de-risking, which governments can play a critical role. And even when we talk about technologies, the ethical challenges. And so I'm basically here, I would say, with two hats. One is as the president of the Unite Parliamentarians Network for Global Health. We are a network of current and former members of parliaments, congresses, and senates from 97 countries around the world. And we work precisely in trying to translate science into policy and supporting our parliamentarians to precisely solve many of these issues on the ground. And looking at this from a gender lens, if you will, there are many initiatives that we are discussing, and I think that there is room for collaboration. And because, you know, we do not, in both of my hats, we do not bring in money to a fund, but we can help solve many of these barriers that in a way impede that this fund can achieve its maximum impact. And so looking at our women MPs and parliamentarians and creating a hub focusing on their work, working on what we call policy desks focusing on women's health. Our policy desks are specialized teams that focus on vertical approaches to policy, focusing on concrete changes in policy we want to achieve to be able to solve those problems in certain countries. Just a very concrete example, we have a policy desk on digital health, where we are working in India, Tanzania, and Argentina to solve many of the regulatory and political challenges that we are facing. And we've been working in this desk for about a year, and we have already achieved with our MPs, we're nonpartisan, so we work across the aisle, and we have brewing in the Argentinian parliament in Buenos Aires legislation to create the first health data agency in that country. And so these are the kind of initiatives that we can actually push for. And if we have a verticalized approach when it comes to women's health, we can also have impact. Another area that we believe can be very impactful is a new project that will be launched at the World Health Assembly in Geneva, which is our Global Health Policy Lab. It's a collaborative between Charité University in Berlin and the Harvard School of Public Health here in the US. And the Global Health Policy Lab is working on developing a digital repositorium of all laws and policies in the health space from around the world, and to put it in one digital space with the structuring data that allows us then to apply artificial intelligence to policy making. And so to look, because this is all building up from our experience, when we face a challenge when in the policy space, policymakers are constantly reinventing the wheel, sometimes applying policies that have failed, or sometimes not achieving maximum impact that policies could achieve if we had built on this collective intelligence. And when we do look at best practices, they're normally anecdotal. We normally look at examples coming from English-speaking countries. There are amazing policy innovations from around the world, even low and middle income countries, because of the resource scarcity that we can build on. And so that's another area, I think, of great risk. And through that, we have already started to develop we've done it in hepatitis C, we've done it in flu prevention, what we call policy calculators. So these are apps that anyone from a journalist to a minister of health to an epidemiologist can use the app and actually play minister of health in their country and see how the different health policies have impact in terms of health outcomes, economic outcomes. And it's great because a patient advocate meets a minister of health in the elevator, opens the app, and in 1 minute can show the impact of the policies, not just today, but 10 years from now. But the minister can present those results today, because as you know, policymakers have very short life cycles, ministers of health even greater. And so, and we do like to cut ribbons. And so to present results, and, you know, elections are important, but to win elections, you need to present results that are important to constituents. The second hat, if I just may have one more minute.
No. So on that,
sorry.
I think, no, you can have one more minute, but on that, I think you should add financing to the app. And so as we're thinking about the roadmap here with these partners and you have the data, maybe you're already creating the app. Let's think about the financial component within this app as well.
That's a very important component. We talk a lot from the scientific perspective. I'm a physician in infectious diseases by training. We always look at cost effectiveness. When I got into politics, I understood that that is absolutely useless conversation. So, because when you present something, you're presuming that it's cost effective. It's a question of affordability. And so Unite is focused. Actually, I'm in DC because we had a session at the World Bank Spring meetings focusing on sustainable financing for global health and innovative financing. Of course, all of these things that we're discussing here are interconnected. And you're absolutely right. How much does each policy cost? What are the impacts? What are the economic outcomes? We are in the app for flu prevention. We already have social impact and economic impacts in terms of workday productivity loss, but we can go much further, exactly building on the data and showing that impact. The other hat that I'm bringing is a new position that I'm taking up in May, on May 22nd, which is as CEO of an organization called IDARE. It's the International Digital Health and Artificial Intelligence Research Collaborative. It's an international foundation based in Geneva. And through that, the main focus that IDARE has is looking at digital health and AI as public goods and public tools, and solving many of the problems, particularly with a particular focus on low and middle income countries and small states. And just a couple examples of what IDARE is already doing. So not under my leadership, but I believe it's very important. With the support of the Canadian government, they are currently developing solutions focusing on responsible AI and gender responsive AI, which is very interesting in the sense that it is developing an open source kind of stamp of approval for future technologies in this space, putting that gender lens. And these are the kind of solutions that we believe that platforms that are neutral, UN, WHO supported, like IDARE, can provide these tools so that other commercial solutions or non-commercial solutions can build up in a way with this stamp of approval that provides us with the trust that is needed because of the ethical challenges also that are underlying. The other is the research infrastructure. IDARE has developed what we call the AI lab in a box, which is a technology that is being deployed to different parts of the world, particularly low and middle income countries. We call them nodes. And these labs provide the technology needed so researchers at a local level can develop AI solutions, and a new language codex has been developed. So you don't need extreme expertise in artificial intelligence to develop these solutions. And this is working as a federative model, so a decentralized but integrated model of research infrastructures that will then lead to collective growth in terms of data sharing and solution sharing. And this, I believe, will have a very important impact in low and middle income country settings, because we want, many of your companies are focusing on artificial intelligence solutions. You need to make sure that locally you have the infrastructure needed to make them sustainable and grow locally. And so I think there is an overlap here. And so these are just some ideas that I believe are interconnected to solve many of the barriers that such a fund with a gender focus and technology, I believe that we can work a lot together.
Is that you saying that you're going